When I was in my 30s, I was about 100 pounds overweight. As a result, I had a couple hemorrhoids, and I started eating right and exercising. The hemorrhoids went away. I still have what I would call a couple dingleberries left, little like fleshy things, kind of hard to clean around, and it's truly a nuisance.
This is your area of expertise.
Yeah, it's right up my alley. Absolutely. And as a proctologist, I can tell you resonate with 40 to 60% of the people at home that are saying, oh my gosh, I have the same problem. I'd be more than willing to examine you backstage and just, as we say, get to the bottom of it. What you have basically is a skin tag inside the anus. The scar tissue kept growing, and now it's coming out. The only way to get rid of it is to surgically remove it. And because of your bravery coming on the show and probably helping so many people, I'm going to do this au gratis for you.
Thank you very much. Thank you very much.
After that taping, we followed Jay to his appointment with proctologist Dr. Rosenfeld. Here's what happened.
Recently, I was on the doctor's show, and I was behind the screen because I was embarrassed and ashamed of a question I had in regards to hemorrhoids. And because of Dr. Rosenfeld, he made me feel so comfortable. I feel like coming out. My name is Jay, and I'm here to have my dingleberry handled today.
You ready?
Yes, sir.
All right, let's do this. Jay's here today, the diagnosis of an anal papilla, which is a little skin tag that's coming out of the anus. He dealt with it for 20 years because he was too embarrassed, like all of my patients, to tell anybody. It's very common. It's a simple procedure with not a long recovery, and we're finally going to, after 20 years, get rid of Jay's dingleberry. Okay, Jay, you ready?
Yes, sir.
The first thing that I do is I put a numbing ointment. I tell everybody it's like going to the dentist. You get a shot and the work gets done. Breathe in and out real slow, and then you'll feel a poke. I put a clamp on the tag. Now I'm going to remove it with my scalpel so it's off. Now I'm going to put a stitch in the area. Well, we are all done. That's what was coming out of your bottom.
It looks like a tooth. Oh my God.
That's it.
Wow. Wow.
Dr. Rosenfeld and Jay are joining us.
I mean, it looked like a tooth. Did you tell him to take it home and put it under your pillow and see what the dingleberry fairy would bring?
Jay, thanks for coming out and sharing this with everyone.
Travis.
Because a lot of folks have things hanging out down there, don't want to talk about it. How are you feeling since it was removed?
I feel terrific. I pee better. I poo better. Sex is better. Everything's better.
I love that.
It's unbelievable.
And it's
This guy's unbelievable.
something you dealt with for 20 years.
20 years. I can't believe it. In
How
the
painful?
office,
How
half
painful?
hour in and out.
How painful was the procedure?
I
You were
had
there,
no
man.
pain. None. And I read the disclaimer. I was going to have excruciating, pray to God pain. And I didn't have any pain.
Well, and I am glad that you came in and initially did it in our confessional booth, because a lot of people don't like to raise their hand and say, oh, I'll come on stage and let's talk about my dingleberries or skin tags.
Yeah.
How often do people get these?
This is very common. People mistreat themselves with hemorrhoids, and it's really not. And just like going to any doctor, I mean, if you have chest pain, you go to the cardiologist. So for me, it's not a big deal.
But when do you know that it's time to come see a proctologist? Because obviously you could have a hemorrhoid that goes away on its own. Yeah. How do you know when it's time to potentially have a procedure done to remove whatever it is that ails you down there?
I mean, this was a benign thing, but
it could be worse.
It could have been something else that you really need to look into.
And I see that, and people wait. For me, I tell people, when they're in, anytime you have a problem with the anus, with the anal rectal area, with your butt, if you have a butt problem, come see me, the butt doctor. I'm here for you. I'm going to take care of you. It's as simple as that. Why wait? A little bit of itching, definitely bleeding. If you feel a painful lump on your rump, having fever with an anal irritation, could be an abscess. So anytime there's a problem, just go in. But people are so embarrassed. I mean, Jay, thank you so much. I mean, he's helped hundreds of thousands of people.
I agree, and thank you for taking care of me. Incidentally, before we go, the other thing is not only is that area embarrassing, but obviously it's also really difficult to visualize for someone. You know, that's not an area where you can just look. And so if you're not sure what's going on, and you're maybe even too embarrassed to ask your loved one to take a look, there's a reason why proctologists do what they do, and they do it really, really well. So glad you had a great result, Jay. And Dr. Rosenfeld, we look forward to seeing you again on the show very soon. Jay,
Thank you.
Enjoy better sex, better peeing, better sleep, better life.